Okay, we're going to deal with APs of the navicular and of the cuboid. So just to double check our anatomy, this is the foot, this is the same side, this is the right leg. We have the talus here, and in front of it we have the navicular coming around to our navicular tuberosity. That's the easiest way to identify the bone on this medial side, and then we can feel across. And then we have the cuboid here, which we can find from the base of the fifth metatarsal, just slightly proximal, and then come across. Okay? So if we work on the navicular first of all, so we have the foot in this position here, so it's nice and stable. We're going to come, as I say, around the medial side and find the medial point here, which is the tuberosity of navicular. From that point, I can then feel all the way across the navicular, which is obviously articulating here. Okay, so our AP, so remember we're going to be coming in this direction here, anterior to posterior, pushing down and through so that we have an effect on the forefoot. Okay, so I'm going to put our thumbs together. If we put our CMCs together as well, it stabilises. If you've got kind of bendy thumb syndrome, then you really want to try and pull that together. You should have nice short nails, and then from that position there, we're going to apply our force coming from our elbows and from our shoulders, and applying that application there. This is my test range. Then come off, and then we're going to grade 1. Barely perceptible movement. Grade 2, emphasize coming off, much larger movement. Grade 3, we can come into resistance now. See, there's a little bit more foot movement now as well. We're taking up the slack in the bed. And then grade 4, towards the end of range, small amplitude. If you do find it difficult in terms of using your thumbs there, the other option would be to use your pisiform. It's just it can be quite difficult to administer. You would be pisiforming here, stabilising the rest of the foot, and then you're going to apply your pressure down and through. It's quite difficult to control though, but just so you've got that as an alternative to use your pisiform if you struggle with using your thumbs. Come on to cuboid now. So we're going to come up, base of the fifth metatarsal, slightly posterior, and then come across, and we're then on this flat bone, this flat edge of the bone here, which is our cuboid. We're then going to come from this medial side and down and through, trying to avoid one thumb on top of the other, but I've got quite large thumbs, so it's quite difficult. You can see I'm having to turn one thumb side on to be able to apply my pressure. Okay, so I'm going to test my range in here. Okay, and then coming off, and then we've got a grade 1. Grade 2, emphasize coming off. Grade 3, more pressure now through resistance. And grade 4 towards the end of range.